Hi, thanks for joining me again on the College Insider. Thanks for coming to my channel. I appreciate you tuning in to my channel every week to get new information. I'm wanting to provide you information on college career counseling, college prep, navigating college, getting the job, parents page. I have so much experience as being a university professor for 27 years and having two children that are college graduates. I want to give back and give so much information to you, and I can only do it if you subscribe and like my videos. So please subscribe to my channel, like my videos, and that lets me know that people are watching them and enjoying them, and I'll keep providing you content every week. So I wanted to go ahead and post one on career counseling this week. And I want to talk about healthcare careers. Every week we're going to kind of pick a few different careers to discuss just to give you an idea. Now remember, go back and watch the first video in this series about career assessments and some of the online assessment tools that you can find to take your interest surveys and see what you're good at, what you enjoy. And then when you take a few of those and start seeing a common theme, or think you know kind of an area that you want to pursue as your degree, then you can come back and watch some of these videos we're going to put together on careers in different fields. Now these are generic careers. I'm not going into an inclusive list of every healthcare career that's out there. I'm just going to list some of the ones that I'm familiar with. This is my area of interest. I have a selective admissions program in healthcare, and so I want to share this with you first, just all the careers that are out there in healthcare. So let's jump right in and talk about some of the skills you're going to need if you want to go into healthcare. The first thing you must do is love people. You're going to be dealing with patients and people every single day, and you have to enjoy being around people. If you don't, you're not going to be happy in a healthcare field. You must love science. Most all of our programs are science-based. There's a lot of science courses. Also technology. All our fields are changing, and all of what we do is technology driven. And so you have to be able to keep up with technology and love for technology and understand technology. Now, I'm not a great IT guru or anything like that, but you have to be able to adapt and at least learn a little bit of technology so you can change with the times. Anything you do, from nursing to what I do in radiation therapy, you deal with equipment and machines, and you have to be able to understand a little bit about them. You also have to be able to critically think. You're dealing with real humans every day. Every human is different. Every problem is different. Every illness is different. And so you have to be able to think outside of the box sometimes in ways to get, what you're needing to do. And so those are some skills that you must possess in order to want to go into healthcare fields. You also need some soft skills. We talked about that last week as well. Soft skills are something that are really needed, especially in healthcare. They're going to be a common theme in these in all the careers, actually. We want to see people that are empathetic, that care about people, that show that care to people. Teamwork, communication skills, stress management. Some of these jobs can be really stressful. You're dealing with sick people every day. You have to have a good work ethic. These people, the patients are depending on you every day. You have to come to work. You have to show up. You have to show up in the ice and sleet and snow, and you have to be there with a positive attitude, flexibility, time management, confidence. What if you have a healthcare provider that walks in and they're not sure what they're doing? That's the first thing that's going to freak you out, is to have someone taking care of you that doesn't appear to know what they're doing. Confidence is key. And respectful. You need to be respectful to these people. They're sick. Most of them have an illness. And so we have to be respectful and understand what they're going through. So here's just a list of some careers in healthcare, and I'll talk about them briefly. There's lots more. I didn't list all of them. These are just the common ones that I think about when I think healthcare. If you want to know more information about one specifically, just Google it. You can find all kinds of videos and all kinds of information, all kinds of things about each of these careers if you just Google them. The Bureau of Labor Statistics will have a lot of information on pay and money and degrees. And these will all vary in, degrees depending on what kind of college or university you go to. But athletic training is usually considered a healthcare career. Now, these are people that work with athletes and people to manage injury and to work with, usually it's athletic or athletes. That differs from physical therapy in that they deal with injury and maintaining functionality and things like that, but they don't work only with athletes. The athletic training is typically athletes. An audiologist is someone who deals with hearing and disease and management of hearing diseases or impairment. Dietitian, these are people that know about nutrition. They work in schools, they work in hospitals, planning diets specific to different needs. EMT is emergency medical technician. These are the people that are in ambulances. They're the first defense when someone has an injury and they call an ambulance. These people, take care of them from the time they arrive to get them till they take them to the hospital and drop them off in an emergency room to a doctor. Very important people. Social workers, they deal with all kinds of situations dealing with children, needs in the home, foster home. Social work is a vast, big field, lots of stuff within that, counseling, all kinds of things like that. Physical therapy is these people deal with injury and getting people, rehabilitated. A physical therapy assistant has less education than a physical therapist. There's less education required, and they do just what it says. They assist the physical therapist. So the physical therapist is kind of in charge of that patient's progress and healing, and the PTA is kind of the one that will help them on those daily activities sometimes. Occupational therapy is a little bit different. They're trying to rehabilitate people and get them back to living everyday life or work skills. So their goal is to help people learn to do everyday life activities and things like that after accidents or injury. And the OTA, the assistant, same kind of as the PTA, they help the occupational therapist. Surgical techs work in surgery alongside with surgeons and nursing. So it's a kind of a field that some people are interested in because it's surgical. Clinical lab sciences, these are the people that take blood, draw blood, then they take the blood to the lab and they run all kinds of tests on it so the doctor can get results and make diagnosis from those lab results. Respiratory therapists, they work with patients with respiratory issues, lung. During COVID, there was a shortage of respiratory therapists. That was a big growth career because they help people with breathing treatments and things like that. Radiologic technology, this is my field. There's lots of different categories under radiologic technology or imaging sciences. You can do general x-ray, or you can do radiation therapy, which is my specialty, which is treating cancer patients every day with radiation therapy, sonography or ultrasound, cardiovascular intervention. This is cath lab, and they look at your vessels through injecting dye and then watching them on x-ray. MRI and CT are tests that they do to look inside your body. Mammography takes images of breast tissue to detect breast cancer. So lots of different careers within radiologic technology, and they're all based on medical imaging and radiation sciences. Speech pathology helps with disorders of language disorders, speech disorders. It can be from a result of, birth to injury to disease processes that they help people get that back. Nursing has lots of categories within it. You can be a nurse anesthetist that works in anesthesia. You can be a nurse practitioner, which can do a lot of things that a family physician can do. And they work in many clinics as the primary care person. They do work under a physician. So lots of things within the nursing field. Pharmacist, who dispenses medication, and pharmacy techs work with pharmacists kind of as their assistant. And then a physician assistant. These are called PAs. They can do anything a family practice doctor can do. So a lot of small clinics, you'll either have a nurse practitioner or a PA that will work taking care of general care for patients. There's many more careers within healthcare, but this just kind of gives you an idea of some to think in case you have never heard of these or just thought, well, maybe that sounds interesting to me. I'm going to go do a little research on that. Just Google them, look at the job outlook, look at the duties of that career every day. There's videos on YouTube of these careers just to get an idea. And if you're interested in a particular one, reach out to someone that may be doing that job and see if you can job shadow. The job outlook for healthcare careers is great. The Bureau of Labor Statistics says healthcare jobs will have a 16% growth rate between 2020 and 2030. That's the highest growth rate of all professions. Now, the reason being is we live in a time when people are living longer. And with that comes greater need for healthcare. The older people get, the more healthcare they need. And so with baby boomer generation being older, they're the biggest population that we've had. Worldwide, the job outlook is great for any healthcare positions. You're going to need an additional 2.6 million jobs within the next 8 years. So think about that. If you want a career that's going to promise you a job, healthcare careers are one of those. The pay is good. And again, there's going to be a big range of pay depending on what careers you're looking at. So Google anything you're interested in, kind of look at the growth rate specifically, the pay, the college degree, but this gives you an idea when you start looking at careers that you want to do, to now look at schools or universities that offer those careers, because not every college and university is going to offer every single one of these programs or career. So look and kind of figure out what you want to do, and then look at colleges that offer that. Okay guys, that was more time than I planned on doing, but I just have so much information I want to tell you about. Okay, again, if you have any questions or you want me to talk about something specific, my email is the.collegeinsider@yahoo.com. Please subscribe, please like the videos, and I will see you next week. Thanks.